Hello there. You're riding in the car with the Chiro, Dr. Anita from Milan Family Chiropractic Center right here in Bayville, New Jersey. Today's topic is prescription medication and side effects. In particular, medications for mood-altering situations, mental health. Most recently, had a patient who wound up suffering some seizures and was hospitalized and tests run and many tests, and was homebound for about, I want to say 2 months-ish, something like that, after she was released from the hospital. Long story short, initially they thought it was related to long haul virus, flu. You know what I'm talking about. Wink, wink. But when she saw the neurologist and he did all these tests, EEGs and, all this stuff, what they discovered was she was on an antidepressant called Wellbutrin. And she never was told by her psychiatrist psychiatrist that one of the side effects is seizure disorder. And when she finally got released from the neurologist, because all her brain scans were fine and that it was determined that it was related to that medication, the response she got from the psychiatrist was, well, that's so very rare and it only happens in less than 2%. And are you kidding me? 2%, that was her. What if that was your mother, sister, brother, wife, or God forbid, child? Those side effects are unacceptable. What about trying to figure out how you can help somebody adapt in their body without altering their biochemistry through these horrific biochemical drugs? What if? I'm not saying there's no use for medication in the world if somebody is really having a mental breakdown. In the short term, it absolutely makes sense temporarily to get people out of crisis. But in the long term, that does not make sense. So I'm asking you today, how many of you that are taking medications have had your doctor who prescribed them tell you the side effects of those medications? And if your doctor doesn't tell you, do ask the pharmacist, because they know. And read. We all have access to the internet today. There's no reason why you can't find out what those side effects are. And you need to decide for you, because the best advocate for you is you, if it's worth going down that pike, right? What are the side effects? Example, blood pressure drugs, which are very prevalent in our society, lower our blood pressure, right? But one of the side effects is heart attack and stroke. Well, wait a minute. Aren't people taking blood pressure medications so they don't have that? Think about it. You've got to be an advocate for you and your loved ones when you are prescribed a drug. Some of the pain medications, guess what they do? They cause chronic pain syndromes. Why are you taking a pain medication if they're going to lead to chronic pain syndromes? Pain medication is designed for short-term use. I'm not saying that there isn't a place for them temporarily in extreme crisis, but you shouldn't be on them for the rest of your life. You shouldn't have to take it every day to alter your biochemistry so that you don't feel pain. You should be finding out why. Are you deficient that drug? Was your body created deficient of whatever medication that you're taking? I'm here to say no. No, no, no. With the exception of insulin. Because if you're born a diabetic, born pediatric, not adult onset diabetes, I'm talking about type 1 diabetes, where the pancreas, these little cells, islets of Langerhans, do not produce the proper amount of insulin in the pancreas. It's just the way your body was created, and you need insulin. Adult onset diabetes is completely reversible. I said that, yes, completely reversible, but you have to take responsibility for it. High blood pressure is completely reversible, but you have to take responsibility for it. Most diseases that are created in our body are completely reversible, most, by you taking responsibility for your health and wellness. And now we're talking about lifestyle. And that is what I talk about every day in my office. So if you're taking a medication or multiple medications, number one, you need to know what all the side effects are. Number two, you need to know the interactions between those multiple medications. And number three, you need to ask your doctor why you need to be taking a medication, quote unquote, forever. Like how many seniors come into my practice and chiropractic practices all over the world having been on medication drugs for 20, 30, 40 years. Their blood pressure is fine. And they don't even know why they're taking them until I start talking to them. And they're like, yeah, nobody's ever talked to me about not taking them. What if your body has adapted? I'm not saying you didn't need them initially. Maybe you were in blood pressure crisis. But maybe you no longer need it because your body's not under the distress that created the crisis in the first place. Maybe by balancing your nervous system, allowing the brain and the body to talk so your body can work the way it's designed to, it no longer requires help. Because that's all drugs do. They help a crisis. They don't solve why. Chiropractic looks at why. So this is Dr. Anita from Mylan Family Chiropractic Center right here in Bayville, New Jersey. We're talking about medication. We're talking about side effects. We're talking about you being your best advocate. And neuropsychiatric medications are the worst medications ever created. Long-term use is a huge problem, and trying to get off them, if you get off them rapidly on your own, that is a huge, huge no-no. So I hope this helped you. If you want your spine and nervous system checked like you should, you need to call me. I'd love to be your family chiropractor. Have a fabulous day. See you on the next ride.